and welcome to the eViP website. At eViP, we're all too aware about the challenges of getting the wider clinical community to accept the use of virtual patients in the medical curriculum. In the second part of our series with Dr. James Bateman from the Coventry and Warwickshire University Hospitals NHS Trust, we talk about his experiences in creating virtual patients and discuss the possibility of introducing a virtual patient classification system.
One of the barriers, or one of the potential barriers that we've found in the eViP programme to adopting a virtual patient approach is the quite considerable effort required into creating virtual patients, particularly ones that are relevant for a particular setting in an individual institution, for example. What about your own experience of creating virtual patients? What are some of the lessons you think that we could learn from that?
I think there's some very important lessons to be learned. I imagine that I have an interest in e-learning, but approaching a clinician who doesn't have that same interest and explaining to them that they may need to develop or edit a virtual patient, I imagine they would consider it to be quite difficult, and also I imagine they would be quite reluctant to sort of embark on a program like that or take on that sort of work. From my own experience using the new software that's been developed, it's actually a very simple process to develop the cases, and I think if clinicians were able to see the simple way in which the path that's followed through the patient's journey is very similar to what we see in clinic every day, and the ease at which you can generate these sort of patients and really produce at the end of some very simple work what is actually a very complicated and very useful product. So I think if we can get clinicians to see how easy it is to produce these, then I think that's something that's going to have to be done if we're going to expect clinicians to use them in their normal clinical practice.
Listening to you talk, it almost feels like we need a different kind of classification system for virtual patients, because a number of the ones that we've looked at already, they're quite in-depth. The cases evolve over a period of time, they can be quite complicated, might be quite extended periods of time, such as months or even years in the patient's life, unfolding in minutes or tens of minutes on the computer screen. But perhaps from what you've just said, there's also a role for much more informal, shorter duration virtual patients, perhaps just based on a single clinical encounter, for example.
Yeah, I mean, I think that's the case. Obviously, when you're developing any new technology, people would want to utilise it to its full potential, but that might not be the best way to engage people that aren't familiar with virtual patients. Even a very simple vignette that may take only a minute or 2 minutes to complete could still actually add a lot of value to the student's experience. For example, if you highlight a rare but important caveat to a clinical situation with just a very simple case, that in itself is a very valuable learning tool. Also, if we can get clinicians to develop these very simple tools, I think they'll be much more likely to engage with the more complicated, larger virtual patients, or potentially larger sources of information. And then, if the clinicians buy into it, then the students, be they undergraduate or postgraduate, they'll also buy into it and see what the virtual patients have to offer.
There's probably a very important message in there. Start not so much small, but start modestly and then build up to something a little bit more complex than perhaps putting individual clinicians off at the early stages by showing them something they feel they just would never have the time to complete themselves.
I think that's very important. When I was thinking about how you could get clinicians to engage with virtual patients, I think the best way would be to set them a task and give them a few minutes, say, here's the software, why don't you try and play with it, why don't you try and develop a very simple case in your area, because that's the challenge. And if you can get people to start engaging with the software and with the idea of that they can actually do this, that it's not the domain of they don't need to involve an IT specialist in a different building, or 20 minutes away, or they can actually do it themselves. If they need to change it, they can change it themselves, and they have ownership of the material they produced. I think that's the barrier that you have to overcome. That's why it's going to be one of the most important barriers.
For further information about the eViP programme, please explore the eViP website. And for news and updates, you can follow us on Twitter on www.twitter.com/virtualpatients, or you can even join our Facebook group at www.facebook.com/virtualpatients.